Hello doctors, Dr. Rashad Dryman here. I'm a general dentist and I have mastered implants. Yes, mastering implants was a dream of mine since I got out of dental school. I didn't really find the right program to join, so I struggled for about a decade and a half. However, I have uncovered now, alongside Dr. Zeef Simon, really 4 steps that you can follow to predictably master implant dentistry. Now, why do you want to master implant dentistry? I wanted to master implant dentistry because I wanted to get off the HMO treadmill, I wanted to get off the PPO treadmill, and I wanted to be able to do things that I feel I enjoy, which is more surgery. I don't really enjoy doing fillings and things all day and cleanings. I want to do more gratifying, for me, gratifying procedures. So, there's 1, 2, 3, 4 steps, and you know what? I didn't know that when I first graduated. I did not know what those 4 keys to mastering implants are. And now that I've really mastered implants, and I'm still mastering them, because look, you can never really stop learning. When you stop learning, that's when you're dead. So there's always a drive to learn and grow. But to get to a point to where you do them predictably, with confidence, and you feel really good about it, you must first get the core knowledge. Now, the core knowledge is the basics. It's knowing how things work, knowing how to do your extractions and bone grafts, how to prepare your implant site. And then once you know how to prepare your implant site with hard tissue bone, you want to know how to, position and plan your implant. And then you want to know how to develop the soft tissue. And then you want to know how to actually do the surgery, the different steps of the surgery. And after you place your implants, you want to know how to uncover them and prepare them to be restored. How to restore your implants, the different methodologies for restoring. And then how to maintain them so that they last your patients for a long time. And so that you can build a great name as someone who does implants at a top level. Because you need to differentiate yourself to stick out in your market and your community to build your name. So the core is the first thing you need to do. The core knowledge. Does that mean you have to read tons of books? Could be, that's one way of doing it. But I'm going to tell you about a way that's a lot quicker than spending 2 years in a residency or reading tons of articles, tons of books. I'm going to give you a shortcut. I wish someone gave me that shortcut before. Now, once you know the core, and that's a core, and I'm going to tell you how to really get that knowledge, and actually within 6 weeks if you're serious about it. The second thing you need is a mentor. Yes, so you have the knowledge, and we've all, went to CE courses, we come back to our offices, we get the knowledge. However, when we actually see a patient come through the door, we're kind of paralyzed. We're like, okay, we know the knowledge, how to apply it. The reason for that is each case is different, and you need a mentor. When you have a mentor and you have the core and you have a patient that walks through your door, then you know how to communicate with your mentor. And if it's a mentor who has your best interest in mind, then you know what? You're going to start learning how to think through your implant cases. Now, there's 2 types of dentists out there. There's dentists who have never placed implants, who are uncomfortable doing surgery, and there's dentists who are doing implants, but maybe not necessarily at the level of a great periodontist does them. Now, if you're someone who's never touched implants and you've never done surgery, but you want to do them, then you don't want to jump and start doing implants on real patients. There is a learning roadmap that you need to go through. And that's number 3 here. The third thing, you need a great hands-on course. All right? So, for you guys and ladies out there, if you have not done surgery, but you still want to master implants, you need a hands-on course. You need the core knowledge, you need a mentor, a trusted mentor, and you need a hands-on course. You don't want to be drilling your first drill into a live patient. So, a hands-on course is very important. What are the problems with hands-on courses? You book a flight, you go to the hands-on course, the instructor sometimes goes too quick or too slow. You don't grasp everything. You step out to the bathroom, you come back, oh crap, what did I miss? Well, there's a better way to do hands-on courses, and I'm going to cover it very soon. So, core knowledge, mentorship, hands-on course for people who have not touched and done live surgeries on patients. Now, if you have done live surgeries on patients and you want to, let's say, you do implants, you want to start doing more sinus lifts, you want to start doing more challenging implant cases, well, you need that fourth thing right here, which is Chairside mentorship. Chairside mentorship. This is gold. This is gold. This is why people go to residencies, because they want to stand there, have, instructors next to them, tell them what they need to do. But what if you cannot go to a residency anymore? What if you graduated, you have your practice, you have your family, and you know what? You can't go to a residency. Does that mean you don't do implants? No. There is a way where you can have chairside mentorship even if you are in private practice right now. Okay? So, core knowledge, mentor, hands-on course for those of you who have never done implants, and for those of you who have and are ready to start placing on real patients, you need chairside mentorship, because the last thing you want to do is a mistake. You don't want to do mistakes here. There's a lot of liability involved. But at the same time, if you follow core principles and you are guided by someone who cares for what you're doing, and you have gone through a hands-on training, then you are ready for chairside mentorship. So, I'm so proud and so stoked and so excited to unveil to the world a project that me and Dr. Ziv Simon have been working on. The goal of this project is to give you, the general dentist, the confidence and the clarity to do implants not at a mediocre level, not on an average level, not just okay, but at a top level. If you want to do something, don't do it just average. Do it at a top level. And that's why we created the IBM Core. The IBM Core is a 6-week modular course that takes you from A to Z for the knowledge, that core knowledge you need. Sure, you can go read 1,000 articles, you can go read, textbooks, but why not get the distilled knowledge that you need to get moving forward? All right, that's what the IBM Core is. So IBM stands for Implant Blueprint Mentorship Program. The Implant Blueprint Mentorship Program has the first level, which is the core knowledge. All right, now, after you get the core knowledge, and you need a mentor, you have the IBM Pro, okay? The IBM Pro is the 6-week modular basic knowledge that you need to have so that you don't have any knowledge gaps, so that you're not missing any key elements, so that when you communicate with other doctors, with your patients, with the lab technicians even, to create your implant restorations, you need to have strong core knowledge. You need to speak the same vocabulary. The IBM Pro, that's where mentorship comes into play. You get cases that walk through your door, and then you send photographs, you send x-rays to surgical master and Dr. Ziv Simon, who is a specialist, and not just an average specialist. This guy is a top-of-the-line specialist. He's my mentor, and I'm opening my books, and he's opening his books so that you can learn and grow and be excellent at implant dentistry. That's IBM Pro. That's IBM Pro that has the core knowledge plus the mentorship. Now, once you have mentorship, once you have core knowledge, let's say your hands are, not used to the idea of drilling through bone, we have the IBM Elite. IBM Elite. And that is everything in the IBM Core, the mentorship of the IBM Pro, plus this box right here. Let's get a shot of this box, all right? This box is an implant practice in a box. What does that mean? This box has a hands-on course in it. It comes with a motor. It comes with surgical kits, sinus lift kits, restorative kits, abutments, restorative components, models. This is called Course in a Box. And you can do that hands-on course from the comfort of your own home. Yes, you get this box at your doorstep. You follow with the IBM training for this box. When you become an IBM Elite member, you get this box and you can do your hands-on course at home. When you're done with the hands-on course, you pack everything back up. You include the prepaid shipping label and you send it back. And guess what? You still have 1 full year of mentorship, all right, on your cases. So you get a hands-on course plus mentorship. Tell me another hands-on course that does that. When you usually go to a hands-on course, and that's been my experience, we leave, I get on my plane, and it's done. There's no more hands-on course. Sometimes I try to contact the instructor, crickets. I don't hear anything back from them. Well, that's not the case here. Everything is recorded. All your exercises are recorded. Plus, you get mentorship for 1 full year. IBM Elite. All right? Now, you got the core knowledge. You got a mentor. You got a course in a box, hands-on course in a box. Now you're ready to start doing surgery on real human beings. Do you want to be standing alone doing that? I wouldn't. One key element about the beauty of a residency is that you have someone experienced next to you. Now, when you're out, when you're practicing, you can stop your practice, go take a residency, or fly to, all types of implant courses that are being offered, Mexico, Dominican, overseas, Europe, or you can have a certified surgical master mentor fly to your office. And that is what the Uber Mentor is, the Surgical Master Uber Mentor. That's basically a residency that flies out to you. So your certified Surgical Master Uber Mentor meets with you prior to flying out for 2 days to stand side by side next to you to make sure that you're executing the planned surgeries as you have planned them before. So using the core knowledge, having a mentor guide you on what you need to do. Your mentor will stand chairside next to you as you do your surgeries. Now that, my friends, is a game changer. If you're out there and you're watching this video right now and you're still watching till now, you're probably watching it for a reason. And this is the time, this is your time to master implants and to master them at a top level. And to do so without breaking the bank, taking time off from your practice and your family, and doing it in the comfort of your own home. We've really thought all this out. Between Dr. Zeef Simon, who's a specialist, and myself, who's a general dentist who learned implants. And by the way, I learned implants the hard way. I wish I had all of that when I was first starting to learn implants. If I had this roadmap, I would have grown a lot quicker. I would have grown without all the headaches I encountered, and I would actually enjoy the journey a bit more. So thank you for watching this video. If you are interested in learning implant dentistry, click the link below and learn more about the Implant Blueprint Mentorship Program. It will change your life. Thank you.